So let's talk about natural supplements for vestibular disorders. If you are someone who suffers from chronic dizziness, I'm sure you have looked at medications, exercises, and possible supplements to help you with your dizziness. And if you go through the online sphere, Google, WebMD, I'm sure you are bombarded with different supplements that you can take and probably overwhelmed. So let's sift through some of the research, most updated, and see what has been proven to be effective and some anecdotal stories about what can be helpful too. I do want to preface that seeing a functional medicine doctor, your primary doctor, or anyone who could help make sure that these supplements do not interact with any of the pharmaceuticals you're currently taking is of utmost importance. You do not want to start taking any supplements without your physician's advice. So there's a lot of research out there on vestibular migraines and supplements. Because 3PD, persistent postural perceptual dizziness, is often comorbid with vestibular migraine, these supplements are often recommended with both conditions. 3PD is a different function or form of dizziness, but very concurrently, I see patients with vestibular migraine who develop PPPD. So these supplements can be beneficial for both conditions, but most studies are cited with vestibular migraine. So let's first start with the vestibular migraine 3PD. The first supplement that I commonly see prescribed is magnesium. So in the research, there is support showing that in the neighborhood of 400, anywhere to 800 milligrams a day of magnesium is beneficial in decreasing the symptoms of vestibular migraine or frequency of headaches. Now, magnesium plays an important role in energy storage of the cells in our body and regulates how excitatory our neurons are. So how excited our brain gets. And we know with vestibular migraine, the neurons are often very, very sensitive and on all the time. So magnesium can help to calm or squash how excited those neurons get when being provoked by stimuli. So magnesium is pretty easily absorbed. The pros and cons of that are sometimes you'll get gastrointestinal issues like diarrhea or loose stool. So to combat this, you might have to, one, work into the amount of magnesium that you are taking. You can also use two different types of magnesium. Citrate might actually have more GI distress, or magnesium glycinate is another version that you can try that should be a little bit more gentle on your stomach. Another tip with magnesium, it does have a calming effect and can boost serotonin, so you might actually want to take that towards the end of your day at night if you're having any sleeping issues with your migraine. The second most common supplement that is researched and recommended would be B2 or riboflavin. So riboflavin is suggested in the research anywhere from 400 to 500 milligrams a day, and it's very useful in preserving our energy storages in our body. So it might help with things like fatigue and brain fog. And again, in the studies, it does show that it reduces the intensity and frequency of your vestibular migraine headaches. The third most common in research would be Coenzyme Q10, which is a naturally occurring substance recommended in the studies anywhere from 150 to 300 milligrams daily of coenzyme Q10. And again, it's one of those substances that does help with our energy storages in our body. Another important supplement that you can be taking is omega-3 fatty acids. There are plenty of reports that do demonstrate that the Mediterranean diet, which is high in omega-3 fatty acids, is beneficial in preventing inflammation. So it's an anti-inflammatory diet. When it comes to migraines, we want to keep that inflammation low. So your omega-3 fatty acids, right up there in that list of common supplements that you can take. You can also get it in your foods from eating fortified eggs with omega-3 fatty acids or salmon, tuna, and mackerel. So that would round out the top 4 recommendations in the studies for vestibular migraine and 3PD. You have magnesium, coenzyme Q10, B2, and your omega-3 fatty acids, or your Mediterranean diet lifestyle kind of eating. Now, vitamin D is another big supplement that's commonly recommended. I'm seeing less of it with recommendations in vestibular migraine in studies, but a lot of us are deficient in vitamin D. Because we live maybe in areas like me in Ohio, despite me taking 5,000 IUs of vitamin D a day, because I live in Ohio, not a lot of sunshine, always in long sleeves, I was very, very low when checking my vitamin D serum with my doctor. So he actually recommended me taking 10,000 IUs for a while. But if you didn't catch that part of the story, I went to my doctor first and I did examine my vitamin D serum levels before supplementing my diet with anything. The normal standard recommendation for your vitamin D in your serum levels would be anywhere from 40 to 60. So if you're looking at your blood levels, you want to keep it 40 to 60. I was on the way low end in like the 20s, I believe. So I didn't feel anything different, but low vitamin D serum levels have been linked to increased risk of developing BPPV, neuronitis, and Meniere's disease. So if you have any of those conditions or are prone to neuronitis, you may want to check with your doctor how your vitamin D levels and start supplementing. Some less common, less studied supplements that I would like to talk about. Curcumin. Curcumin is an antioxidant that can fight inflammation. Not a lot of studies to suggest a certain diagnosis, but anecdotally, I have had patients who do use curcumin and they feel better with it. So even if it's a placebo or I can't prove it, I cannot tell you that it does or doesn't work. You have to try it out for yourself and see if you feel better. It is an antioxidant that has anti-inflammatory properties, so it may in fact be helpful for you. Feverfew is another supplement herb that I have not heard until I started researching this. So it's an ancient herb commonly found in South America. In the ancient times, it was used to treat pain, inflammation, nausea, and vomiting. Less studies on feverfew, but again, it's one of those things that you can try and see if it works for you. Ginger is another that has been studied in treating acute vestibular migraines. It is known to thin the blood, so make sure that you're not on any blood thinners when taking that, but it can be also helpful with nausea. And I did find a study that recommended taking a quarter of a teaspoon within 2 hours of a vestibular migraine attack and can be helpful at reducing that intensity. The last one that I have seen at least mentioned was ginkgo biloba. Again, it can thin the blood, so be careful if you do take that. But again, it has some natural anti-inflammatory properties, so could be useful at dealing with some of our vestibular conditions. So with all that said, this is just a supplement recommendation list. Please consult your physician if you do have any questions specifically about dosages. I cannot recommend anything in particular, just what I can tell you I've seen cited in the studies. Also, this list is not to make you feel overwhelmed, just to make you think about maybe what you're putting into your body and why you're putting it to the body. Make sure you have some science backed up about the amount that you are taking. I have a lot of patients who tell me, oh, I take a vitamin, a daily supplement, and we'll look on what that daily vitamin actually has as far as dosages in there, and it's nothing close to what is actually supported in the studies. So remember to take a look at your daily vitamin bottle. Make sure that dosages matches up to what the evidence does suggest in relieving some of your vestibular symptoms, or as always, talk to your physician. Hopefully you found this video helpful. Make sure to leave any comments below if you did like the material or if you have any other comments or questions that you would like to ask. Until I see you next week, stay healthy, stay steady, and stay strong.